Welcome back in, everyone. Let's dive right into the deep end. Recently, 3 organizations announced a partnership with the goal of transforming healthcare in Pierce County.
The partnership unites Pacific Lutheran University, MultiCare Health System, and Washington State University's Elson Floyd College of Medicine around 2 goals: preparing students to become local healthcare leaders and improve health outcomes in Pierce County. And joining us is Pacific Lutheran University President Allan Belton and MultiCare CEO Bill Robertson. Good morning to you both.
Good morning.
Good morning.
Thanks so much for being here this morning. So let's start in talking about this partnership here. Why did your organizations team up for the Partnership for Health Innovation, and why is this needed?
Oh, absolutely. Well, Bill and I have the good fortune of serving the residents of Pierce County at both of our organizations, and the more we got to know each other as individuals and organizations, one of the things we realized is that we have a very common overlap of our missions to serve the residents of the county. PLU has a history of producing wonderful nurses and folks in the health field, and the largest employer of our students happens to be MultiCare. And when we got to talking about the needs in Pierce County, it became just a natural partnership.
Well, it sounds like
We at MultiCare really value the graduates of PLU. They are all the way from senior leadership to a big percentage of our nursing staff, and Allan actually serves on one of our regional boards, and so is engaged with there. So, you know, a really shared mission of service in our communities.
It sounds like a lot of students, like you mentioned, tend to take up careers with the MultiCare organization. Can you talk about how else this benefits students?
Well, the plan that we're working towards in the partnership is there will be clinical opportunities for students to learn how to be clinicians that will actually reside on the campus of PLU, because we'll have healthcare delivery happening on that campus. So that's a really significant piece of that. And then a broader set of educational opportunities connected not just on that campus, but with WSU and other parts of the MultiCare organization that PLU students will have the opportunity of engaging in. Because, you know, healthcare is actually a practiced activity. It's a very human activity, so you have to get experience to be good at it.
Yeah, one of the things that I'm really proud of as a Washington State grad, who happens to be the president at PLU, is bringing medical residents to the PLU campus, and eventually, you know, having our nurses and the Elson Floyd College of Medicine's med students learning together side by side is going to produce much more effective care providers in the future.
You know, healthcare is a very team activity, so it's not that one group does something and that, like physicians, and then the nurses do things. It's all an integrated team activity, and so being able to learn together actually enhances the ability of individuals to be great team members in the service of patients in the community.
Why is it so important, you know, for students that are kind of going through these programs to stay local? What kind of impact does that have on a place like Pierce County?
Yeah, it's a fantastic question, and actually that, truth be told, that's what I think brought us all together. When you look at our missions and in terms of who we're trying to serve, MultiCare is the largest not-for-profit healthcare provider in the state that's locally based, and they're based in Tacoma, and they're statewide. And WSU has a mission with their College of Medicine to serve all of the counties of Washington, and at PLU we're very regional. So 70+% of our students will come from right in Pierce County. And I think where we have this truly amazing once-in-a-lifetime opportunity is to really produce healthcare, providers of healthcare who reflect their community. We all have a goal to provide equitable, culturally competent access to healthcare in Pierce County.
You know, the reality is where people train, a very significant percentage stay in that community. Importing people from elsewhere in the country is a difficult thing to do, and so training people where they're going to live and have their families and age is really a very productive way of making sure we have all the professionals that we need in healthcare to meet the needs of the community.
Well, thank you so much, Allan, Bill, for joining us on ARC Seattle. It sounds like we are in great hands with the next generation of our healthcare leaders, right?
Absolutely.
Absolutely.
Yeah.
We got to say go Lutes and go Cougs.
Yeah.
Go Lutes, go Cougs.
That's right. Thank you, gentlemen. Nice to meet you this morning. Yeah, I think there's something to that. You know, when you grow up in a specific area, say you're from Pierce County, you have family that grew up in that area too. You know, staying in that particular area when you're moving up the chain and starting your career, that sort of thing, I think you have more care about the people within that community because that's who you've grown up with, and you're used to those areas. You're used to a lot of the people that you see out there. So it's really cool to have this program to sort of connect folks locally and have them stay here in this region.
That representation is important.
It matters.
That geographic representation, and it sounds like the program's going well so far. It sounds like kind of like a feeder. You think about like feeder schools. It sounds like a feeder workplace for many of those PLU students. So it's a pretty neat partnership, right?
It is.
Yeah.